So we have Chris Lemon from Johns Hopkins University, clinical doctor. He was in the emergency room the day that the ship broke the bridge of Baltimore, remember, 2 months ago? He was there. Wow. Sadly for him, nobody entered finally for sad reasons in the emergency room, but basically he's a clinician, no? And also the director of Planetary Health Alliance. Chris, we are expecting here, waiting for your presentation, and you can stay with us until 50 minutes more, maybe, you told me, maybe?
Oh, yeah, don't worry about me. Can you hear me okay?
Sorry, one moment, we don't hear you. One moment.
How about now?
Yes, now, yes. Go ahead.
Great. Okay, wonderful. And I should be sharing a presentation screen. I don't know if that's coming across for you.
Yes, one moment.
Great.
Thank you.
Yep.
Enlighten us about planetary health in America. Thank you.
Yeah, I'll do my best there. So with that in mind, thank you for the introduction. I wish I could be there with you. Trust me. I could use a vacation right now. As Jordy said, I was there when the bridge came down a couple of months ago, and that was awful. But many more things to worry about right now and push forward. So I am directing clinical programs at the new Institute for Planetary Health at Johns Hopkins, and that's part of why I'm here to talk to you. But I'm also supposed to be addressing planetary health in the healthcare sector, which, first disclaimer, that's going to be connected to all the other sectors. And second, for North America, which I certainly don't pretend to represent all of North America, but I'll do my best, having chatted with some folks, to tell you what's going on. I will speak fast because I know we're past time here, but I wanted to say my 3 takeaway points for you is I hope you get one connection out of this. I'll share briefly about myself because I can't be there to network with you, but I'd love to stay in touch. I hope you're able to take one tool away from this, and I'm going to present about 10 in rapid succession about things that I've come across that I think could be helpful to you. And I want you to take home one idea, maybe something that I've come across or that we're working on that you may be implementing in your own home. And lastly, I just want to make sure that you maintain that sense of wonder. I think right now more than ever, we need to be paying attention to the fact that there's something amazing about nature and we're connected to it in so many ways, and yet we've gone away from that. Connected to health, because our health systems are very similar to the systems of the planet. And they're so delicate and so amazing at the same time. And lastly, yourself, especially those of you who are still sitting there in the afternoon right now. But more importantly, whatever you're doing to contribute in this fight towards planetary health, it's important and it's going to be taxing on you, but you are an amazing individual for doing this. So pushing right into things here, I want to give a third disclaimer. So number 1, I'm an American. Number 2, I've got 4 kids, which is not particularly sustainable. The twins were a surprise, I will admit. But the point is, we are theoretically a, quote, normal family. I pretend like I'm doing something for the environment by driving an EV SUV and dressing my kids in Patagonia and North Face. Clearly, that's not solving the world's problems. But to be a little bit vulnerable for a second, my daughter was entering kindergarten when COVID hit. And this was a paper that we pulled out of her bag. You know, you bring your kids' assignments home from school, and this was defining the 3 feelings she felt most. Number 1 being sad, as both of her parents were working on the front lines during COVID. And clearly that took a toll on us, but this was a gut punch. And this was actually my call to action, to do something about planetary health and the way the world was going. And so I hope you remember what it was that spurred you to be in the seats that you're in right now and carry that forward. For me, it was this reflection of the fact that in healthcare, we thought we were invincible. We thought we would just keep pushing forward, especially in the United States. And of course, COVID caught up with us. And for the first time, many of us in the global north felt truly vulnerable, especially in positions of privilege. And I'd say at Johns Hopkins, which is internationally known for medicine, in 150 years, we blazed forward to the point where we have these amazing resources in public health and nursing and medicine. And even that couldn't stand up against COVID. And so my concept here is we know systems are breaking down in the world in terms of balance. We've seen that despite improvements in healthcare, we're using everything in the world at an unsustainable rate. And these trends are only going to lead to, unfortunately, a reversal in our good fortune. And so as I move into things, planetary health framework, which you all understand, continues to be framed within these mediating factors. And that's what I want to focus on, is that the impacts of this are going to be felt differently everywhere. So speaking from North America, we have a huge responsibility in trying to solve this because we've been one of the most responsible parties in causing this. And I say that from the standpoint of healthcare, as we heard earlier, contributes to 5% of global emissions. In the United States, it's 8.5%. We are harming everything by caring for the people that we are signing up to see in medicine and nursing. We're cutting down the forests, we're causing climate change, we're crushing biodiversity, and it all kind of comes around to the sense of, are our human ways better than the natural ways? And so what we're trying to look at now is, how do we get out of that framework? And healthcare, ironically, is one of the biggest contributors in North America, can also be one of the biggest advocates. What's our role in making this better? And I would say that it's no longer just the polar bears anymore. It's the people. We are the polar bears. It's come to that at this point where we're feeling the health effects right now. And so for those of you in healthcare, thinking about the stories of your patients is so important. We're doing a lot of work right now in the humanities and the arts, trying to focus on connecting people back to the human spirit. I heard earlier, not forgetting that there's spirit beyond the technology. These are the stories that are going to make a difference going forward. We've pressed beyond many capabilities of disability and diseases that otherwise would have killed people 100 years ago, but now we're teetering on the edge of a reversal, especially for our most vulnerable populations. And so with that in mind, I just point out what you already know, that we're in crisis right now. The degradation of our natural systems is a leading contributor to the global burden of disease. And at the same time, there are things we're going to start going through right now that are going to make this better. I don't get paid by Britt Ray, but I've heard her speak a few times now, and I want you to pick up this book if you can. It sort of makes sense of all of this anxiety that those of us on the front lines of planetary health are feeling, and helps to turn it in a way that you can actually start taking steps forward. So without further ado, humanity's pretty great. I say we just dive right into these because I know we're running short on time. So number 2 would be the Planetary Health Alliance. I'm sure in this conversation, I don't have to explain what that group is to you, but this is my new family now that they've moved to DC in the United States for their international secretariat. This is over 70 countries. This is hundreds, 430 members, I think last I checked, that are all working on this from around the world. And there are great resources, Matthew may touch on this more in a little bit, that are available through their website. But importantly, we now have this new international secretariat, and I won't play the whole video, but this is where they have now moved their international headquarters to in DC, and this is the building that we're working out of.
555 Pennsylvania Avenue sits at one of the great American crossroads, right in between the White House and the U.S. Capitol. The energy of this location is palpable. You can feel passion and purpose radiating from every corner.
Welcome to the Johns Hopkins University Bloomberg Center in Washington, D.C. A 12-level steel and glass building with views of the Capitol, serving more than 2,500 students and 650 faculty from across all divisions of the university.
This building represents the future of education. It's designed to promote interdisciplinary collaboration and bringing people together with different perspectives and different areas of expertise to solve tough problems.
And so along those lines, it's very interesting, which I'll come to the Institute in a second. We are specifically forming a hub for the Planetary Health Alliance outside of DC because we do not represent North America in general. That shouldn't just be DC in the United States. It should be more representative of everyone. So that's coming soon, actually. There are meetings ongoing about where that will be. But for us in this new Institute for Planetary Health, this is something that Hopkins gave us to work collaboratively across the disciplines with the goal of improving and safeguarding a livable future for humanity on Earth by essentially drawing together faculty from across Johns Hopkins to work with the Planetary Health Alliance. So I have the great fortune now to be in a meeting in an hour from now with a UN planetary health lawyer, a Hopkins and NASA aerospace engineer, heads of education, and experts in the built environment. We are trying to blaze through collaborative projects pushing forward with international organizations, not telling them what to do, but working collaboratively with them. Beyond me to touch in the last few minutes on what else is going on in North America, I reached out to our Canadian counterparts because they happen to be working the most closely with us, and Mexico has already jumped in with Latin America in the PHA framework. Canada's ahead, I will say. They have this academic health institutions declaration that all of their medical institutions, all their med schools have signed on recognizing planetary health. And I encourage you to look up these QR codes or contact me later for all of these websites and resources. They have written with international experts on how to actually go about putting planetary health education into this. This is Courtney Howard, who's leading the charge up in Canada. And then Hussein Molo has actually made it so that planetary health is going to be a required piece of education for all medical residents going through Canada as of later this year. This is huge. And so please reach out to us if there are ways that we can help with your healthcare and medical systems in terms of education. In the US, we're a little bit more fragmented, unfortunately, and so we've approached things from a more piecemeal basis of what fits best to each different region in the United States and have come together with these groups in a consortium on how to improve US's footprint in the planetary health problem. And we meet every year in DC. I was just at CleanMed in Salt Lake, but this is the US conference for Healthcare Without Harm, which is obviously internationally recognized as well. If I can give you one innovative thing they're doing, they've actually partnered with our American Medical Academy and the American Healthcare Engineers Society, and we now have an online consortium of almost every academic medical center in the United States, from doctors to nurses to engineers and facilities, as well as education experts, trying to figure out how we can all get on the same page across the US. And we're also leveraging our big national groups like the National Academy of Medicine as convening powers. So we now have the heads of insurance, private sector, public sector, all working together on figuring out everything from healthcare supply chains to decarbonizing our sector. Nurses, as usual, are way out in front on this. The Alliance of Nurses for Healthy Environments, if many of you probably know Teddy Potter, I reached out to her before giving this talk, and she wanted to make sure I drew attention to the amazing work that they're doing, but also include this QR code for how to talk to patients in clinical situations about climate change and planetary health. If you don't have something like this in your country, you could be the first one to generate content like this that makes it available to those who need it on the front lines. And speaking of front lines, there's this amazing program in the US that you may be able to recreate or work with elsewhere that actually develops content, even badges, QR code badges you wear on clinical shifts that patients and your colleagues can get information from if they just tap the QR code on their phone. We have developed educational programs in the US. Colorado pioneered this about 7 years ago with everything from hybrid model online educational fellowships that are intensive for a year to certificate programs in multiple sectors, and they even wrote a textbook. I'm excited to say we're actually starting a planetary health specific fellowship for clinicians through the Institute of Planetary Health at Hopkins. So my first person's coming on board in a couple of weeks, and we're going to build from there. And Medicine for a Changing Planet is open access online. If you haven't seen this is Stanford and University of Washington have posted case studies and medical curriculum content geared at planetary health. It has the slides, it has all of the resources. You can learn how to teach it just by going through it, and the quality is amazing. So this is open access to everyone as well. And lastly, I won't play this the whole way through because we're running low on time, but I'm very big on content curation when giving PowerPoints. And so if you haven't heard of this, this is the group that does David Attenborough's films with Colin Butfield, who I met in Malaysia at the FAM conference this year. They've now made open access to much of their content. All right, so I cut it a little short just for the sake of time, but you get the point. I've been using it this morning with some of these. You can access thousands of pieces of media for your presentations at a level of people who are producing for Netflix, and it's open access so that we can convey our message in a more brilliant fashion. So I know I'm closing on time, but the quick take homes I wanted to bring back were, I hope we've made a connection somehow. If there's something that I can do for you in my seat from DC, being at the International Secretariat for Planetary Health Alliance, as a clinician on the front lines, as someone who's working in this clinical program section of our new Institute for Planetary Health, please reach out. I hope any of these tools that we're using in North America right now might be useful to you, and I hope you come away with an idea, even if it's building a badge that your providers can carry on shift in your hospital that links to some of this content that's already there. And last, again, do not forget the amazing power of nature, health, and yourself in trying to figure out how we're going to get through this together. Thank you so much. I appreciate it.
We only have a few minutes. Just a very quick question, and maybe other questions from the public before you go. You have an amazing, wonderful building, by the way, in the middle of the political power, Washington. Did you move that for that reason, or why? How do you see your politicians with planetary health?
Certainly, we're closer to them now, but I'd say it's that was part of my understanding for why the Planetary Health Alliance moved its secretariat to Hopkins, was the opportunity to have a space in that new building to be close to political influence and really be at the heart of what's going on in the United States, because there's no room, no time to lose whatsoever. And so we are trying to take advantage of all of that footprint in DC, as well as the fact that we're embedded with all of the other schools, like the School for Advanced International Studies.
So the question goes as follows. You've succeeded, okay? You've managed to implement planetary health training across the US, and this started today, and we're 10 years in the future. And every single medical professional is now implementing this in the way they work. How does this look like? What has changed as a result of this? What do you see? Small question.
Yes.
Yeah, I was like, isn't it time for happy hour?
You need to go. Yeah.
It's only 10 something in the morning here, so I don't get out of this that easily. But I mean, it's a great question, and that's what we've been talking about, imagining futures. We just wrote a grant on this to try to be internally funded at Hopkins to bring our institute together, literally discussing like Demunet, like imagining the future we want, and then how do we reverse engineer that across the sectors in our institute to make our university function that way. And it's something we've been thinking about in the healthcare sector, because as you know, the US healthcare sector is a mess. And I'm not a healthcare policy expert, I'm a clinician, but we're a combination of private, public, government run. I mean, it's just such a conglomeration that my hope is that this brings the systems together to some extent. We're having a huge issue right now with corporate takeovers from private equity groups who are buying up health systems, and that's even putting more burden on productivity and efficiency. And I think, like Sam Myers always says, if we get the diagnosis wrong, we get the treatment wrong. If we start reframing our clinicians to think about this in a planetary health way when they're getting their education, the hope is that this expands, even economically. It creates positions within healthcare to work as sustainability officers. I know coming down the pike for us, it's looking like sustainability is going to be either a carrot or stick with the way that our health systems are reimbursed. And so if this works in 10 years, the hope is that people are thriving in this space, working collaboratively, and maybe most of all, I'm sure it's this way in the rest of the world, everybody is burned out here in healthcare, especially coming off of COVID. We need hope. We need something that we feel like we can get our hands around and improve. And this, to me, symbolizes what we're going to be able to do with this.